Good morning, good afternoon, good evening to my favorite caffeinated, medicated, and never hydrated bestie. It's your favorite Nurse John, and welcome to your favorite podcast therapy. It's I beg your pardon, bestie. I miss you. How's life? I miss talking to you every single week, bestie. We always have this gossip. We always have this conversation. I like this. We should call it Therapy Friday. You know what I mean? Like, we should always have a talk like this because it helps us heal. It helps us relieve all our stress. And we need like a day in a week where we all take our stress out and so that we come clean for the next week type of thing. You know what I mean? Because sometimes we keep it all to ourselves and next thing you know, you're exploding of emotions and it's not good, bestie. It's not good. Anyways, how are you? How is life, bestie? I just want to say, if you're listening right now, I just want to say that I am so proud of you. I am so proud of every little things that you're doing for yourself, in your career, and every day. And even just waking up, Bessie, if you woke up today, I just want you to know that I love you, that you matter, that everything you do, that there are so many people who loves you, and you deserve to be in this world. You deserve to be loved. And I want you to say that to yourself every single day. Affirm it to yourself. Believe it. Manifest it, baby. That's the only way for you to find self-love, and then you're going to discover self-care when you love yourself. Remember? And I will keep repeating this every single week until it is stuck in your head and until you repeat it to yourself too, bestie. Okay? And listen, if again, things doesn't go the way you want it, bestie, remember, that's because it's not meant to be yet for you right now. It's gonna come when it's supposed to. And never ever compare yourself again to other people because, bestie, jealousy is the worst enemy of happiness. So being jealous of others' progression, others' lives, what others have is what makes you unhappy. So focus on yourself. Focus on what makes you happy. Focus on your journey. And always remember that no matter what other opinion is about you, it does not matter. You know why? Because the only opinion that matters is the one you tell yourself every single day. When you look at the mirror, when you wake up, whatever you tell yourself is the only thing that matters. And that should be positive things. Things that affirms yourself and is gentle towards yourself. Because again, this world is so cruel. This world is so negative. And you should be positive for yourself, for your own growth, bestie. And again, I am so happy that you're here. I am so happy that you're listening right now. And I am so proud of you. I love you. Okay? And before we continue on this episode, do me a favor, bestie. If you're listening to this right now, make sure that you download this episode and you share it to your Instagram and you tag I beg your pardon and me at Nurse John so that I can repost it. And bestie, please do me a favor and follow us on Spotify and Apple Podcasts and make sure that you listen to every single episode. And also, bestie, if you're wondering what kind of scrubs I wear, what brand of scrubs I wear, in my clinical as a clinical instructor and in my videos, it's Garde Malade, Gardemalade, which means a nurse, a caretaker in French because I live in Montreal, Quebec, and we speak French in here. And that's the old way they say nurse in French. And you can use my code NURSEJOHNGM, Nurse John GM, on checkout so that you can get a 15% off discount, bestie. And again, bestie, I love you so much. So let's get into this episode. So this episode is all about, for all of my healthcare workers, what is something that people, which means the public, who doesn't work in healthcare, you want them to know or understand. And people have submitted so much stories, and baby, listen to this. And if you are someone who doesn't work in healthcare and you're listening to this, or you have a family who works in healthcare, this is something a lot of healthcare workers want you to know and understand. Let's get into it, bestie. Our first submission. Violence is not part of our job. Yes, you are sick, but it's not our fault that you are. Let's work together. Don't raise your voice just because. It's hard to empathize when you are only doing it to nurses. Woo, baby. This is so true. So what's happening right now in healthcare and mostly in nursing is that we are experiencing a lot of like physical, verbal, and emotional violence not only from our job, but also from our patients. And again, I understand that some patients are frustrated because they're not getting the quality of care that they deserve. And that's totally normal. I would feel the same. But one thing I would never do is blame the nurses or the healthcare workers working and those people who are trying to help you. We don't deserve physical, verbal, or emotional abuse from you guys. And again, people who cannot control their emotion should not even say anything. If you are the type that you know that you can get angry easily or you cannot control your emotion, take a minute, take a deep breath, or just leave the situation. Or if you are the patient and you are in your room, just ask your nurse to leave. But your healthcare worker or your nurses doesn't deserve to be disrespected. Again, we want to work with you. We want to heal you. We want to help you get out of this hospital. But the thing is, we are so lack of resources. We are so lack of help that we cannot give you what you deserve. So another thing that the public has to understand is that we are not the problem. We don't want this. It frustrates us. It makes us angry at the same time because we love this job. We are passionate about nursing. We are passionate about what we're doing. But the thing is, if I'm given 15 patients, how do you expect me to scratch your back or get your ice chips when I have 15 lives in my hand that I have to balance and make sure that everyone gets an equal care? And there's also this thing, priority. Every single one of you guys are priority, but someone takes over something. If someone is dying and someone is just wants to go to the bathroom, I am not attending to that person who just wants to go to the bathroom. I am attending to the person who needs to be revived back to life. And that's how it works in anything. And I know you guys deserve to be treated right and to be given that help. But the thing is, again, if we're short-staffed, if we're not able to do it, we are going to attend to what's most urgent for us to do. We use our critical thinking to identify what needs to be done first compared to the other ones. And again, it's not to dismiss that everybody's concern is not a priority, but again, something takes priority over the other. If you just want me to change your dressing of your surgical incision, but the other patient is having a chest pain, I have to attend to that person who's having a chest pain because you are not dying and that person could be dying from a heart attack. That's how we think. And again, if we come 45 minutes late, 60 minutes late, put yourself in our shoes because that's what a lot of us nurses and healthcare workers do. We always put ourselves in your shoes. We feel bad. We feel regretful for not being able to accommodate you as fast as we could. But again, we're not waiters. We're not slaves. We're not maids. We're nurses. We do so much things that's not even part of our job. And we do it out of compassion, out of empathy, out of love. So please, treat us with respect. Treat us with kindness and love, just like how we do it for you guys, because that's the only way we can do. And let's work together as healthcare workers and patient and fight the real enemy here. The CEOs, the hospital, help us so that we can help you. Next, I would like the public to understand that when they are patients and we are telling them to do something themselves that they have been doing independently themselves for years, for example, cleaning, changing your stoma, if we are telling them to do it themselves, it's not because we don't care. It's because we have to try and make sure they keep their independence. Some patients come in and turn into toddlers, asking us to empty their stomas or wipe their bumps for them when they are absolutely capable of doing it. And this is so true. Again, we are not dismissing that the reason why you're in the hospital is because you're sick, but at the same time, we have to make sure that you keep your independence. Okay? Again, the hospital is not a hotel. We're not servants. We're not supposed to be attending to every single thing that you guys want. And again, if you're doing things at home by yourself, you should be able to do them in the hospital. Unless you are very sick and you're really incapable of doing it. Like, for example, you cannot move from your bed and you're unable to go to the bathroom, of course we're going to help you. But if you're just lying down there waiting for an x-ray and you ask us to change your briefs just because you're in the hospital, well, no. Not because we don't care and not because we don't want to help you, but because you are absolutely capable of doing it. And again, we want to keep your independence because there are so many patients who loses their independence once they go to the hospital, because we do so much for you guys and we treat you guys like almost like some patients are treated like kids. Okay. And again, we're doing so much for you guys. And then at the end of the day, when you get back home and we do everything for you in the hospital, how are you going to do it yourself? How are you going to take care of yourself if you get used to nurses and CNAs and everyone else doing everything for you? Even my 78-year-old, let's say, who lives alone and got into the hospital, let's say for a fall or for a surgery, we push them to do it themselves. Because when they get back home and they're alone and they choose to live at home alone, they have to be able to do things alone. Because no one is going to come to their house and stay there. Like, I'm not going to come as a nurse to your house so that I can bring you to the bathroom. You have to be able to do that if you choose to live alone by yourself. So yes, again, it's not that we don't care, but we want to make sure that you keep your independence and you keep your strength. Again, if you're in the hospital, we want your strength back. We don't want you at 0. We don't want you at 20. We want you at 100 so that you can fully and capably go back home like you were before you were hospitalized. Okay? Period. Next. I would like the people to understand that short staffing is not in my control. How about the whole I have rights as they verbally and physically assaults you? Yes, a patient has a right for healthcare, but I have the rights to go to work without being called a bunch of names or physically hurting me. I became a nurse to help and assist, not to be a punching bag. Nurses should be treated better, and that's on period. So there's a lot of news coming out lately of nurses being physically abused, and there has been situations where nurses actually died because patients have attacked them. And this is, again, mind-boggling to me because the news is not even out there. It should be out in the world for people to see what we're actually experiencing. Like, this is not fair. Already we are treated shit by the government and the hospital, and the people we are treating, the people that we're waking up to take care and heal, are also doing the same thing to us? Like, what the fuck is wrong? Like, what are you guys waiting for us to have? Like, are you guys waiting for all of us to die? Are you guys waiting for all of us to just quit? Because we can. And I'm going to tell you something. Nurses are the back fucking bone of healthcare. And if we're gone, this whole fucking healthcare system is crumbling the fuck down. And you guys are going to regret that you treated us this way, because once we're all done, you're not going to... you are all going to be sick and you're all going to die. I'm sorry, but that's the truth. It's so hard to hear that, but that's what's going to happen. So please, protect us just as much as we protect you. And stop disrespecting and assaulting us, because we deserve the same respect we give to you. Okay? And I'm not saying that there are not nurses who are disrespectful, who are rude. But again, your bad experience doesn't turn into you hating the whole healthcare system or you hating every single person. Because not everyone is the same as those people who have hurt you. And I know trauma exists, but at the same time, that doesn't mean that you're going to treat everyone else how you were treated. Hate this. Next, that patients are completely different when family members are present. When family are around, they behave themselves. When family leaves, they get aggressive, rude, sexually inappropriate. And oof, man, I can attest to this. It's just so funny because there are situations where patients would literally say that they weren't giving care or attention or anything when their family is around. But then we've done so much for them. when their family's not there. But then when their family's there, they complain to their family. And so the family gets mad. They go to the nursing station or find the manager and complain that, oh my God, my dad didn't got water for 7 hours. Your dad had a pitcher of water and he was peeing 6-7 times in like the past 45 minutes. Yes, he did. He probably didn't got it for once and it took like 35-45 minutes because we're attending to something that is more priority. But that doesn't mean that we didn't give your dad his ice chips and water. We did. But he was so unsatisfied and he thinks like he's paying us from his taxes. Now, all of a sudden, we were mistreating him. He was mistreating us. And that's on period. Ugh, oh my God, I hate this so much. Or the situation where you've done every single thing to this patient and then they talk to the doctor and they tell the doctor that, oh my God, my nurse haven't done this and this. Excuse me? And you're telling that to the doctor who comes 5 minutes every single morning. And I have been with you for the past 24/7. Be fucking for real. Be fucking for real right now. Like, some people are so ungrateful, you guys. I cannot. Next. We are social worker, not miracle workers. No, I can get you into treatment if there are no beds available. No, I can detox you in 24 hours. No, I can fix years of trauma in 15 minutes. What I can do is be supportive, encouraging you, and guide you on your path. Oh my God. The social worker. Baby girl, we twinning. I understand you. Some patients too think that we can heal them and get them out of the hospital in 30 minutes. And I completely understand this social worker's frustration because there are patients and there are family who doesn't understand that things takes process, okay? Things has steps for us to be able to follow it. Now, because it's taking forever doesn't mean we just put it aside and we don't give interest or energy into it. But that's not the whole case. Listen, some facilities doesn't have beds, so we cannot really move you. Do you really think we want to keep you on your room for 7 months when you're walking around healthy, just staying in the hospital? We don't want that. We want to put someone else who's sick, who needs a care or attention. We don't want you to be lying down in your bed the whole time and just doing nothing when you're already strong. It's just that there are no spaces available. And if there is, you take priority again based on your situation. But not because you've been here for 7 months and somebody else came in 2 months ago and they got a bed first. Doesn't mean like we don't care about you. Maybe because that person's situation is more intense or needs more attention compared to yours. But again, it depends. Social workers do their best to help you guys at home, in your finances, in your life situation, in your family problems. Again, social workers too do so much more than their job sometimes to help you so that you can go back to the community and be human again. But the thing is, like, you guys cannot put so much pressure on social workers and healthcare workers to do your job as quickly as possible. We're not magicians. Like, we cannot just like click our hands and things are gonna come our way. We're also frustrated that we cannot give you what you deserve. But that's not in our control. That's not on our hand. You have to understand that as a patient. Oh my God. I love you, social workers. Cheers. Take a shot with me. Love you. Next. Having a higher scope of practice than another healthcare provider does not give you a right to talk down or belittle them. We are all pieces of the same puzzle. You cannot finish a puzzle without all the edges pieces holding the rest of it together. Ooh, baby. This is so true. One thing I can tell you guys is that if you ever feel threatened by a coworker or by someone who has more authority, I don't want to say more authority, but like another profession that thinks that they are above you, don't let that happen. Set your boundaries and tell them, I don't like how you're talking to me. We are a team. We're supposed to be working together. If you cannot work in a team, don't. Because I am not entertaining this energy and I am not being treated less or belittled by you. Period per. Next. Something I would like members of the public to know, well, new friends and acquaintances, is that they don't get to ask me about all their health conditions or for advice. This is so true. I don't understand, but for some reason, family members think that because you're in healthcare, let's say you're a nurse, social worker, nutritionist, you know the answer why they have a mole in their back. Like, you can diagnose them. Like, baby, I already do this at work. Like, why are you making me critically think when all I wanted to do was relax, enjoy this day, and forget that I am working in a hospital? I have been asked so many times, like, oh my God, my throat hurts so much. What do you think is it? Like, I don't freaking know. Go to the emergency. Like, why am I the first line of call 811? A nurse would help you. But not me, baby. Like, don't put your life on me. Like, I understand we're family and whatnot, but like, if I'm not at work, I'm not a nurse. Baby, I'm clocked out. If I'm not getting paid, we're not working. Okay? No work for me. No worky. Next. Something people need to understand is when you come to the ER by ambulance, it doesn't mean you'll be seen faster. The patient gets triaged like anyone else and gets a priority based on their reason of visit, symptoms, or medical history. So there's a message for both parties here. 1. People taking an ambulance so they can be seen faster, you are wrong. Please let the paramedics take in the patient that really have no other options. Paramedics are overworked and busy. Let them do their job for the patients that needs it. 2. Patients in the waiting room don't get to discourage when you see a line of ambulance. It doesn't mean they'll be seen faster than you who has been waiting for hours already. As mentioned above, they get triage and get priority just like you did. Voila. Here's the message I want to send out to the community as an ER nurse. This is so true. So when you guys visit the ER for the public, and you get triaged by a nurse and they ask you, what's your situation? What's your situation? Why you come to the ER? There is a set of lists that they check off that puts your priority. It's either priority A, B, C, D, or 1, 2, 3, 4, depending on your case. Again, a lot of times people come to the ER with the flu or a sore throat. If you come to the ER with a sore throat, you will not be seen fast. You could wait 24, 48, 72 hours because, baby, there are other people who needs more attention than a sore throat. And again, it's not dismissing the fact that you don't have a concern and you're not sick and you're not going through something, but you cannot expect us, you cannot be mad that you've been waiting there for 72 hours. I get frustrated too when I go to the ER and it's taking forever for me to be seen. But that's the situation in the ER. Again, we're telling you this so that you understand and you don't get frustrated to us because we are just doing our job. And again, people coming from an ambulance doesn't mean that they get seen faster than you who has been there for 48 hours. Maybe that person just came for fall, but didn't have any fractures. They're okay. They were just brought by an ambulance. That's all. But again, we do priorities. Someone who's critical and needs more attention takes priority over someone who cracked their left foot. Sorry, but you cannot be seen fast enough because there are other people who needs help before a cracked foot. We will give you pain medication. We will reassure you that, okay, you are in this top of the list. And please, another thing I notice is like people tends to go to the triage nurse and come back every single freaking time asking, am I next? We can tell you, okay? Like you cannot keep coming back and no, okay, you're fourth now. Okay, you're second. Okay, you're first. No, we don't know. Because if someone comes in with a chest pain and you just have a cracked foot, we're going to take the chest pain as a priority. Not because we don't like you or we don't want to serve you, but because that person is a more urgent care. Listen, 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 Linda. Next. I want the public to know that when you choose a DNR or to be resuscitated, you don't get to choose compression or shocking. It's not one or the other. It's all or nothing. I have lots of families saying they think they get a list to pick from how they want their loved ones to be resuscitated. Okay, so this is a very sensitive topic because, again, in my grandpa's situation, even though, he was suffering that time and he was really sick and he was dying, because I am unknowledgeable of like healthcare and how it works, we would choose for him to get compressions, or we will ask him to be full code. Full code means like we will try every single thing for that patient to come back to life if they ever coded. And there's code B, C, or D, and D is like nothing at all. And then B and C, you can kind of like pick and choose of like, okay, we will intubate, but we will not resuscitate. Or like there's a lot of things basically. But the thing is, what people don't understand is that you cannot pick D, level of care D, and then put in there resuscitate, because it's gonna take away the meaning of like D, just comfort. D is comfort. We make sure that you're comfortable, we make sure that you're not suffering, and then you pass away relaxed and calm. Okay? But I understand that some family, they still want to try. But again, if your mom or your dad is like 90 or 97, I just want to preface this is that if you choose for us to do a CPR or a full code them, there is a high chance we will break their ribs. And it's not fun. And if you're 97, you're fragile, your whole body is just aching, your whole body is just, it's fragile basically. That person would be suffering. We can revive them back to life, but I am telling you, the suffering that they're going to go through just to get back to life is not fun. You wouldn't want to be in that situation. I keep telling people, like, if I'm super sick and let's say, my life is ending, please don't put me in full code. I just want to be relaxed. I just want to be calm. I just want to die in peace. And again, it's different for every single one. But again, we're just telling you from experience that if someone is, let's say, suffering a lot and you want us to bring them back to life at 97, there's a high chance that they're going to suffer more when they come back to life. Or we break their ribs. Or many other things that they're going to suffer more. Okay? And if you're unknowledgeable with this kind of things, you can always ask your nurse and ask the doctor, because sometimes doctors, they explain way too freaking fast and you don't understand anything. So the best thing you can do is ask your nurse. Your nurse is going to provide you more with a detailed, proper explanation what a full code, level of care B, C, D. And if not, you still try to look for someone who can explain it to you properly, because you have the right to know what you're getting into and what you're signing in. And again, never ever sign anything just because someone suggested it to you, because there are healthcare workers out there who would suggest you things. And I'm telling you, you are the main person who can decide what you want to do in your life. So don't let anyone's opinion affects your decision. Okay? Period. I really love what I do, and I want the general public to know that there are career opportunities in healthcare that don't require direct patient interaction, but you still play a dire role in diagnosing disease and ultimately helping to save lives. This past summer, we had multiple patients come through the ER with fatigue or fever. Looking at their blood under the microscope, I determined that the cause of their illness, a parasitic infection from a tick bite known as babesiosis. To know I helped pave the path for multiple patients' diagnoses and care was the most rewarding feeling. It makes the long, stressful 8 or 12-hour shift worth it. I also love more people to be aware that blood work done in a hospital doesn't just go down to the basement and put into a machine. There are plenty of well qualified clinical lab scientists working behind the scene that ultimately help relay important information. That is so true. Okay. First of all, to our lab people, I'm sorry, guys, that we're kind of mad when you guys call us and you guys tell us that the blood is hemolyzed, because I absolutely believe that you guys are hemolying. I'm sorry, I'm kidding. You're not hemolying, but baby, it took 12 nurses to get that blood. And I know you guys are expert. I'm not saying you're not, but I'm just saying it took 12 people to get that minimal blood. So make it work, baby. It's not our fault. And I'm not picking that lady anymore because I am the one getting punched, okay? So it's not hemolyzed. You're going to make it work. No, I'm kidding. But thank you to my lab people. And she is so right. There are so many career opportunities in healthcare, mostly in nursing too, where you don't really have to work in bedside. Like what I'm doing right now, I'm a clinical instructor and I loved it so much. Love it so much that next semester, in the winter semester, I am applying because I applied to be a med surg, a psychiatric, or an ER clinical instructor because those are my main specialty. That's where I am. That's where I feel good. I thrive in chaos, baby. If it's not chaotic, it's not me. And I know it's traumatic, but that's my norm now, basically. So yeah, I love being a clinical instructor. Again, I still go to the hospital, but I am not handling lives. I am handling the future of nursing, the future of healthcare. And it makes me feel good knowing that I help these kids grow. I help this new, young, professional, aspiring nurses to feel confident, to feel validated, to set boundaries, to grow as a nurse, and to know self-care and self-love. And I am so happy to be part of it. And there's so many opportunities where you don't have to work in bedside. Again, it's people are leaving bedside, baby, and you can always have another career that you love to do. If I can be a chef in the future, I would be a chef and then a nurse. But now I'm doing nursing and then content creation, which I super love the two, and it's working really well. Again, find your passion, and again, don't think that your life is stuck in one job. You can do things. Life is too short to be regretting every single day and waking up with a job that you hate, okay? And again, ironic coming from someone who got burnout from nursing, but again, it's not that I don't love it's not that I hate nursing. I love nursing. It's just the condition is really shitty. I didn't realize that way faster and I got to the point when I'm burnt out. But I'm just saying that you don't have to stick in a job that you're not happy, okay? So choose something else. If you want to be a flight attendant after doing nursing for 20 years, do it, baby. No one's going to stop you. Doesn't matter if you're 50, if you're 60, or you're 70. If you have the energy, if you have the passion, if you have the attitude for it, do it. Who's stopping you? Life is way too short, okay? And again, nursing, if you want to go to nursing, let's say after being a hairstylist, do it. Doesn't matter if you're 45. Does being 45 affects your ability to care for someone? I don't think so. I mean, you have more back pains than I do. But I'm just saying, baby, if it's a passion, if it's a calling for you, do it. No one's stopping you. Keep going, baby. I fully support you. I was a neuro-telenurse, now a nurse case manager. Ooh, okay, nurse case manager. How's the pay, baby? How's the workload? If I were to reflect on my experience at Bedside, where I work 3 days a week, 12 hours a shift, some may tell me that's it. That's it? Lucky you. People need to realize that despite it only being 3 days a week, those 12 hours, anything can go wrong with your patients. You don't just go about your day and know that everything is cool and everything is okay. One time I had a patient that came in for COPD and he was still a walkie-talkie guy that was lovely and had a nasal cannula on. But then around 2 p.m., I found him unresponsive to my voice and painful stimuli and checked his O2, his oxygen, and it tanked from 95 that day to like 85. I had to call a rapid response team and RT. They came and I had to transfer him to our ICU. Mind you, this was my first day by myself as a new grad and not with my preceptor. Thank you. whenever I go out with my friends and I tell them and they ask me, they're like, "Oh my god, how many days do you work?" I was like, "I work 3 days, 3 days a week." And they're like, "Oh my god, you're so lucky." I'm like, "Baby girl, I told you I work 12 hours each shift. And those 12 hours are sometimes 14, 15, 16. So that is full time. If you count it, it's 36. And plus the overtime shift I have to do because I have to stay longer because there's so much shit going on in the unit. It tallies to 40 hours. And sometimes longer and more. Because I get freaking guilt trip to taking more shifts. Okay? And again, like what she said, those 12-hour shift is not easy. Like, we don't come to work, we're like, "Oh my god, I only have 3 days." 3 shifts, those 3 shifts can literally make you looking like 28 to 75, ready to retire and die. I am telling you, nothing goes right in healthcare. Somebody could be walking and talking at 8 a.m. and at 2 p.m. we're trying to revive them and bring them back to life. I'm telling you, it's not easy. Things go wrong in healthcare every single shift. Like, there is no shift where everything is just flowing right and properly. There's always something that needs to happen and that needs to stress you out in healthcare. So no, 3 shifts, 12 hours is not lucky. I'm telling you, you guys can come with us to our shift so we can show you how shitty and how crappy it is to do those 12 hours because it's no fun. Okay? And I understand some of you all are in a really good unit or specialty, but a lot of times if you work in ER, ICU, med surg, psychiatry, cardiac, nothing goes right, baby. I spend nearly all day, 5 days a week thinking about others and doing things with other people in mind. Then I come home, I'm still thinking about others. What should I make for dinner? Have the dogs been taken out? We need to go grocery shopping, etc. It's fucking exhausting. And I wish I had a break every now and then where my family would pick up the slack a bit and think outside themselves more. I feel like this would apply to working women with families who still take on a lot of household wife responsibility. Oh my God, this is a frustrated mama. And mama, I cannot empathize and sympathize with you more. I am so sorry. And you are right. Some people just don't understand how draining it is to work in healthcare. You thinking all day long, critically thinking, figuring out things, resolving stuff at work. And then when you get home, you still have to take care of the kids, think about dinner, think about laundry, think about cleaning the house, the dogs and everything. It's a lot. And all we ask is we get help. We get help from our partner. We get more understanding. And a lot of times is that we just need some space. Sometimes we just need to be alone. We just need some peace and quiet because every single fucking day we hear pumps, we hear people screaming, we communicate with people. Like sometimes I just want to like disappear for a good like 5 freaking hours after my shift and just come back when I'm ready. But that's not the reality for many nurses who are married and have kids and have shit to take care of. And I am so sorry. The only thing I can suggest to you is that you have to think ahead. What I have noticed and what I have done for myself is that I prepare food for the whole week so that we can eat something every dinner and I don't have to think about it. Like a Saturday or a Sunday when it's your weekend off, like you can make like a big, large amount of food and then separate it and put it in like 20 lunch boxes. And that's what you guys eat and freeze it or something. Because that's the only way you can really do things easier. Again, I think it's more of like organizing and more of like thinking ahead and being advanced. Because again, I'm the type of person that when I get home and the house is messy, the dishes are there, there's laundry, I tend to just focus on trying to fix it and make sure that everything is clean. Because again, I cannot live in a house when it's messy and shitty. I just don't feel comfortable. Like when I get home, I want to feel relaxed. I want my house to smell good. I want everything to be fixed and organized. I don't want it to be messy as fuck because already you're dealing with mess at work. And again, maybe that's just me, but for my anxiety to stop, I have to start cleaning. And it's super hard because at the end of the night, you're just so tired. You don't even want to go to work the next day. But you have to. You have no choice. You have to work. But again, all I can say is that you have to plan ahead and talk to your partners, talk to them. Just be very brutally and honest and tell them exactly how you feel and how exactly you want to be supported. Because again, if your partner is an accountant or they work at home, they can do more things, okay? Like they cannot be like, oh my God, I also had like a 12-hour shift. It was so hot. No, bitch. You don't understand how hard it is to work in healthcare, okay? We're taking care of people. We're thinking every single second. And at home, we still have to think every single thing. We have to take over every single thing too. Again, a relationship is a partnership. You should be all working together and things has to be equal. Actually, that's not true. In a relationship, it's not 50-50. Sometimes it's 90 and 10. It's 80 and 20. But the most important thing is that you guys are open to communicating to each other. You guys are open to constructive criticism and hearing each other, instead of like fighting and being against each other. Because again, relationship, you should be fighting the problem, not each other. Period per. I would really like for people outside of healthcare to understand that we do try our best with your families and loved ones. We do the very best we can with the resources we have and the staff we have. I also want them to know that as much as we try our best, we can always cure or fix or have an answer or the answer they want to hear or things. Sometimes it's just, it is what it is, as difficult as that can be. And I mean this with a respectful way. We are in God, but we sure do try our best to help as best as we can. This is so true. Again, it's the same thing. Again, we do our best, and it's not that we're not putting attention or energy into it. But the thing is, like, we don't have the answer to everything. We don't know why the doctor hasn't shown up. We don't know why the x-ray is not happening. We also just receive information from other people in healthcare that is part of the team. Okay? Again, don't put your frustration and anger to us. And I understand you don't feel good, you're frustrated, you're angry, but we're not a punching bag. You guys should feel for us too. We want to help you. Do you really think we don't want your dad to go to surgery today? But is that in our control? Why do I deserve to be shouted at? To be asked to do something right now, and if I don't do it, you're gonna ask for my manager and fire me because I cannot do my job properly. No, I am doing my job properly, but I am not in control in every single thing in the hospital. Again, I am paid to do my job, but I'm doing more than that because I actually care about you, about your family, about my patients. But again, we can only do as much, okay? So please, feel for us, just like how we feel for you. I want the public to know that healthcare workers don't always just wipe bums. We hold their hands. We listen. We're there when they're confused. We help them get dressed and ready for the day. We're there when they laugh and cry. We play games. We help fed and give medication. We don't spend 12 to 15 hours just wiping bums. I literally used to hate it when people would say, oh, so you wipe bums? Then when I used to tell them I was a healthcare assistant, that is so true. This goes out for my CNA and even the transporter, the housekeeper. You know what? I have seen so many transporter, housekeeper, CNA. They sit down with these patients. They treat them with so much respect, so much love, so much compassion because everyone who works in healthcare just wants to be able to help. We all care. We all have the heart and the compassion. And again, don't minimize us to our job. We do more. Again, all of us do more because we care and we know how it is to be suffering. We know how it is, how difficult you're going through or how difficult it is for your family to be in pain or to be in the hospital. And we do more. We're there when you're sick, we are there when you're better. We are there when you cry, you laugh, you scream. And again, we're still there. And you never leave our mind. You never leave our memory. You're always going to be our memory. I still remember 85% of my patients. I can tell you that. Because I still think about you and I'm wishing that you are doing well in life and pray that everything is going the way you want it. Okay? Okay. Last 3 stories. I would like family members of patients to know that we are not their waitress, waiters, or their personal nurse. If I have 5 patients, I shouldn't have to bring your friend 2 hot coffee with cream and 2 sugar. Go get your own coffee from the coffee shop downstairs or bring it from home. I am trying to keep your loved one alive along with other patients and their complex needs. And shouldn't have to worry about it if you need a coffee refill. Also, I once had a family member ask me to apply a medical patch to her lower back. I was hesitant, but I said yes. And with that, she pulled down her pants. Oh my God. So I could put a medication patch she had brought from home on her back. Family members and friends of patients don't realize how much we have to do in a day. And chart. For each of our patients, I just wish they would be more respectful of our time. We are there primarily for the sick patient, not to cater to their family. And period per. And again, you don't have to. You can refuse to do it. And if they report you, and then they report you, who cares? Like you said, you're not a waiter. You're not a personal assistant. You're not a personal nurse. They're not paying you for this. Don't do it. And sometimes, like, it's hard to say if you're not in that situation. But I think it's time for us to really set boundaries and let people know that we are not going to be mistreated that way. Because again, we are being mistreated every single day. And some nurses right now is being mistreated or being treated like a slave. And we should really start standing up for ourselves and leaving this kind of job and situation because we don't deserve it. You deserve to be treated as human being. You deserve to be treated as a professional, as a nurse. Oh my God, this next one is literally what I just said. I want people who don't work in healthcare to know that your healthcare team thinks about you even after you leave the hospital. Even if I never see you again, I often think about you and hope you are doing well. And that is so true. I still think about Mr. Smith and wishing that he's doing well and his liver is functioning well and life is going great for him. And even the patient who have died, I wish that they are happy. I wish they are in a place where there's no more pain. It's all peace. Because you guys never leave our lives. Like, it's just hard to forget patients. And I know some nurses are going to say like, oh my God, that's too much. Like, you shouldn't be too attached to your patient. But I'm a human being. What are you going to do? I'm just a human. I have a heart for people. I have a heart for some people. So yes, I will feel this way. And again, that's just me and maybe someone else. But that's okay. That's okay. But for the public, I want you to know that, you know, if I ever take care of you, you're still in my mind. And I'm praying and wishing that everything is going right in your life because I care. I work as a pharmacy technician. I wish people would understand that our best interest in dispatching their medication is ASAP. But dealing with insurance, doctors, and providing customer service is really complex. The medication dispatching process, I think people see it like putting Skittles in a jar, when it's far more than that. If customer pressures us, one mistake on our behalf can kill someone. And I so wish people could understand that. To my pharmacy people, thank you guys for your hard work. We really love you. But where the fuck is my antibiotics? It's not in the fridge. It's not in the patient's bin. It's not any... I'm kidding. I'm sorry. But yes, it is so true. Preparing medication and making sure the medication is right is more complex than you think. Pharmacy prepares medication with precision and they cannot even make a mistake because like what she said, one mistake can kill someone and that's the last thing they want to do. So please, for the nurses who's been asking for the iron pill and it's been 8 hours, they're probably sorting it out. I'm kidding. But yes, like, guys, we have to be more nicer to our healthcare team, to the people working with us. And I understand sometimes it gets you frustrated. And I am guilty of being frustrated on pharmacists sometimes because, baby, if I fax you the medication 4 times and you told me it's going to come, it should come in the next hour, and the next hour passed, and then it's now 8 hours and it's still no there, baby girl, what's going on? What is happening? I need that medication and I am getting blamed for that. Okay? But yes, pharmacists deserve to be respected and super, super right. So this is the last one. I'm a psychiatric nurse and I'd love it if families of patients understood that setting boundaries is not being mean or cruel to patients. It's healthy and helps with recovery. This is so true. Again, nurses setting boundaries or those who can set their boundaries are not mean. But this is a way for us to protect ourselves, to protect our sanity, and to keep us safe. Because some patient takes it to the extreme and think that they could control us, they could physically, mentally, verbally abuse us. And if we don't set that boundaries early on in the care, we would be mistreated. And it happens, and it's happening. Like I said, there's so many news right now of nurses being physically, verbally, mentally abused by patients. And that is not right. We need to be treated better because we are the one providing you care. So yes to boundaries, yes to not being rude, yes to not being disrespectful. That is so true. And again, oh my God, there's so many things I want the public to know. Here is something I want new grad nurses or new nurses to know is that if you leave your nursing job early on, let's say after 4 months, after 6 months, after no matter how long it is, okay? I want you to know that you are not stupid. You are not incompetent. It's not that you do not know how to work under pressure. You are not weak. You are perfect, okay? You're the type of nurse who are able to recognize your limits and your boundaries, and you set it right because you don't want to be insane and you don't want mental, physical, or emotional damage. That is totally fine. Don't feel pressured by your colleagues or your colleagues who have been working in that unit for 20, 30, 40 years tells you like, oh my God, you only have been here for 8 months. How come you're leaving already? You're not gonna last as a... No. Those people are the reason why nurses are eating their young, okay? Don't listen to them. Listen to your gut feeling. Listen to your heart. Listen to your body. If your body is telling you and if your gut is telling you that this job is toxic, this job is not the right thing for you, do it, okay? And if you just started nursing and you're like, you know what, this is not for me, this is way too hard, this is not... You can change your career every time and any time, okay? If you want to be a hairstylist, if you want to be in fashion, do it. You did not waste your time. You did not waste your energy. You're doing what's the best for you. Because at the end of the day, it's your happiness, okay? You have to be happy waking up every single day, going to the job that you choose to do. And if you're not, then you should stop doing it. Because life is way too short to be spending on things that you're not happy or it's not making you happy or it's not making you grow. Do something that you love, bestie. And I love you so much. And I am so proud of you. You have to realize that every single small thing that you do is worthy. And you are worthy. Thank you so much for listening to this podcast. And I hope you've gotten a lot of advices, a lot of things that you can relate to and use for the future. Okay? And do me a quick favor, bestie. Again, if you're listening to this, make sure you download this on Spotify and Apple. And make sure that if you haven't listened to other episodes, download them too. Follow us on Spotify and Apple, turn on notification, and make sure that you take a screenshot and post it on Instagram and tag me, and I beg your pardon so that I can repost it. And bestie, I love you. And if you haven't seen, the shirt I'm wearing right now is caffeinated, medicated, and hydrated. And bestie, she came back on stock. So if you want one of these, if it's still available when this podcast gets released, You can find it in www.nursejohn.com. And I love you guys so much. I will see you again next week. I love you so much, Bestie. Mwah.